Doing pretty well then.
Oh,
Okay, folks.
but it's okay. I mean, she's already had it, so we're grateful, you know.
Ready?
Yeah.
Okay. This meeting of the Ramsey County Board of Commissioners is called to order. Would the clerk please call the roll?
Fretham,
Here.
Mattis Castillo,
Here.
McDonough,
Here.
McGuire,
Here,
Ortega,
Aye.
Reinhardt,
here.
Carter.
Here. Thank you very much. And we'll ask if Commissioner Fretham would lead us in the Pledge of Allegiance while we all mute.
Madam Chair, I think it's my turn.
I'm sorry. Thank you. Take your turn, please, Commissioner Mattis Castillo.
Thank you. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Much appreciation. And so we have the agenda of our February 2nd meeting before you for approval. Is there a motion?
Move approval.
Second, Madam Chair.
Thank you very much, Commissioner McDonough and McGuire. Is there any discussion on the agenda? Roll call, please.
Mattis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Carter.
Aye. The agenda for February 2nd has passed, and the minutes of our January 28th meeting are before you. Is there a motion?
So moved. Second.
Second.
Thank you, Commissioner Ortega, and I believe I heard Commissioner Mattis Castillo. Thank you for the motion and second. Is there any discussion? Thank you. Would the clerk please call the roll?
Mattis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Carter.
Aye. Thank you. The minutes from January 26th have been approved, and we are moving on to our COVID information section. Today we have COVID information. We do have a workshop following our meeting. However, I do know that we have people in the chambers who are able to share information with us and respond to any questions that commissioners may have. I am aware there have been questions raised regarding vaccinations, and in particular feedback that we are receiving from the community and concerns that we all share regarding the distribution of vaccines in an equitable fashion. I have asked that there be someone here to respond. I know that we have our Public Health Director. And we also have Dr. Ogawa here. I'm going to turn this to County Manager O'Connor to see if someone can respond on that question. And I also am looking to any others that commissioners may want to quickly ask today. County Manager O'Connor.
Thank you, Madam Chair. Members, good to be with you today. We have Deputy County Manager Kathy Hadeen here in the chambers, and then Dr. Lynn Ogawa and Laura Anderson, I believe, who are leading the vaccination effort in public health, available with you today by Zoom. So I will turn over to DCM Hadeen to share just a few thoughts on the vaccination piece with you and some of what we're seeing, and then we can answer any questions you may have.
And thank you. When I say in the chambers, I actually should say in our virtual chambers sometimes. Thank you.
Good morning, Chair Carter. I am actually in the chambers, and then Dr. Ogawa and Laura Anderson are online via Zoom with you. We have had a few questions from many around how are vaccines getting distributed equitably right now. And so I will go through a bit of what we're working through to ensure that we can provide as much access as possible to all of our communities, including Black, Indigenous, Latinx, Asian, and other communities of color. And I'll lay out a little bit of information too about how information is being gathered. The system that we all use and I say we, most local public health departments use to register people into our system to get vaccines is called PrepMod, and that software does ask for voluntary race ethnicity data. Our screening forms also, which are pieces of paper, also contain a fillable area for race and ethnicity information as well. So there are ways for us to gather this information. Right now, as you know, and we continue to communicate, our county public health department has very limited supply of vaccine, and we are following federal and state guidelines on how we can distribute that vaccine. So for the most part, as we've stated in the past, the people that we are seeing in our closed clinics, closed means that they are not open to the general public right now, are essential workers, a part of our phase 1 in areas of like EMS, healthcare, nurses, other healthcare professionals, and workers involved in testing and giving vaccinations at this time, also congregate care settings. To the degree that people in those jobs are from diverse Black, Indigenous, people of color communities, vary significantly among those agencies within those professions. And that is something that I think all of us hope that all of those professions continue to work on to diversify their clientele and their employees. But unfortunately, those who show up from those organizations are not representative of the community that we are currently working within. They are, however, doing amazing work to support, to protect our communities, and so it's important for us to make sure that we are and continue to vaccinate this population. As you know, other groups within our state are also targeting specific areas like teachers and 65 plus, which many people in our community have gotten on a wait list, and some lucky people have gotten their first vaccinations. So as we work through our system, as we work with the state, we continue to partner to do what we can to broaden our reach here and communicate with our state partners how very important it is for us to make sure that we are reaching the populations who reside within Ramsey County. Something else I think is important to know is the state has done quite a bit of work at connecting with 17 federally qualified health centers, or FQHCs, in Minnesota. Many of our FQHCs have received vaccine, and as you know, FQHCs do have very specific populations that they work within, typically BIPOC communities and people who are of lower income. And so I've had a conversation recently with one of our partners, United Family Medicine. They are really moving through their vaccines and getting them out there as fast as they can. Again, they are following state guidelines, and so they are being asked to focus on 65 plus populations. As we move through the phase A and into phase 1B, you're going to find that you're going to see an increase in the data and the diversity of data that we have available. There are a lot more BIPOC communities within that 1B group than within the 1A. So I will hold there and open it up for any questions. And then again, Dr. Ogawa and Laura Anderson are also online to help answer any of these questions that you may have.
And again, thank you for being here with us and for sharing that information about priority distribution of vaccines and how, in fact, we are also able to, with a dual mind, understanding the limitations of the priority currently, focus on communities of color through our work with the FQHCs. We look forward to hearing more about the data that is being collected on who is being vaccinated so that we can ensure that we're getting to those priorities, those multiple priorities, and seeing vaccination across multiple populations to the extent that we already know communities of color are unequally impacted. We want to make certain that we see the distribution in that area, as well as we see the impact of the disease. So thank you so much. I do not see additional questions. You've provided information to us in different formats. I do see a hand coming up from Commissioner McGuire, so I'll ask her.
Thank you, Madam Chair. My raise hand button is not working on my screen. But anyway, thank you for acknowledging that, and thank you, Director Hadeen, for that background. I really appreciate it, and you've heard from me, Director Hadeen, because I think we're all hearing from our constituents and from people that live in our areas, because they see other counties or other buildings getting some of the things that they feel that they're the same as, and maybe it's in a different county, which maybe you could address again, but it is the consistency, and I am, totally supportive of our focus on making sure that we're vaccinating all of our diverse communities and equally on that. But if you could make any other comments on just some of the inconsistency where some facilities that deal with vulnerable communities are getting vaccinated, and then other areas that are dealing with vulnerable communities aren't. So just a little bit more on that inconsistency, if there's any way that you can talk about that, and I can give you specific examples if you want. But
yeah,
thank you,
Madam Chair and Commissioner McGuire. Thank you for the question. Certainly would love to know more about what you're describing as inconsistencies. I think some of the confusion comes around where a congregate care setting falls within the phase that we're in currently. Some fall within outside of phase 1A. But it seems like they should fall in 1A. And so that then creates this optic of this doesn't feel fair. I see this is happening somewhere else. With that said, too, there were some discrepancies around long-term care and independent living. And so some of the pharmacy programs working with long-term care we're not including the independent living people within the vaccination clinics that were set up. And so work had to be done to connect with local public health departments and with the state to make sure that we were helping to fill those gaps. We've trained 300 people, I believe, maybe a little bit more than that to date, who can also help provide vaccinations within community. And the more people that we train, the more ability we have to send out small mobile groups into these areas to be able to pick up where large distribution centers haven't been able to access at this time. Laura and Dr. Aga, if you want to add to that, please do.
Chair Carter, commissioners, I can just add in that some of the discrepancies have to do with how various facilities license themselves. So at the state level, the decisions were made around how to best support specific facilities who had licensed themselves under specific licenses. So we do have a number of congregate care settings in Ramsey County that truly do provide a continuum of care. And unfortunately, we have been starting to handle those requests from independent living facilities who are very much co-located with facilities that provide a higher standard of care. And we'll continue to do that work. We have a good strike team system set up in place, and we are building capacity to address those facilities over the next 2 months. As we also continue to broaden our footprint and support vaccination for other communities concurrently.
Thank you. I really appreciate that work. And just thanks for giving those, just giving a little more background in that, because I just, I know that you're doing the best work that you can. And I want to help others understand, just some of those, what may cause what appears to be inconsistencies, but there really are, with what you're talking about. So thank you.
Madam Chair, if I could just add one final comment too to Commissioner McGuire's, which is inconsistencies in application of the guidelines by other entities supplying vaccine, like that can happen as well. And all it takes is one inconsistency where someone jumps a line or gets access before maybe they were supposed to, for us to read about it or for you to hear about it. Mm-hmm. And so one of the biggest pieces that has been a focus from the deputy county manager on down has been adhering to the guidelines as created to ensure that those most at risk, as defined through MDH and the CDC, are the ones at the front of that line. And that will lead to moments of tension as we hear stories or someone says somewhere else, hey, I know this person who got up in the line. And that's going to be a challenge with us. I think ultimately the question is less of one of inconsistency compared to other jurisdictions and more about, are we remaining consistent to the guidelines as developed by the state that we're here to implement?
Thank you so much. I appreciate that clarification as well. Yes, I'm confident that's what's happening as well. Thank you.
Thank you, Commissioner McGuire. Commissioner McDonough, and then Commissioner Ortega. Commissioner McDonough.
Yep, thanks, Madam Chair. A couple comments. First, I'll comment on Kathy's kind of laying out kind of where we're at here, especially when it comes to the equitable distribution of the vaccine in our community. And I talked with one of my constituents this weekend, and I know she emailed a number of us. And I told her, it's important to hear those stories, right? Her husband was fortunate enough and was able to get a vaccine through the state, went and waited in line. Over 100 people, he was the only person of color in that line. Her minister, same story. And so she started hearing that and checking it, and it was just frustrating for her to hear and those experiences of her loved ones and people in her community. She's a strong community advocate and really does carry a message for the community. And so it's important to hear those, but a lot of those decisions are out of our control, but we do have influence. But Kathy, as you laid out, and I need to call this out, it was there. But one of the reasons, and me and my constituent had a conversation about this, one of the biggest issues is this: not only has the impact of COVID impacted our BIPOC communities in a greater degree, but our response is hindered in being equitable based on years and years and generations of racism and inequity. Kathy, you talk about professions that are deemed that need to be up in 1A, and those are professions that we do not see people of color ever getting into because they lack access to the education or they've just been excluded. All the way down to your last comment about their access to the vaccine is through federally qualified clinics because they have no insurance. And so I just need to, as an elected official representing the community, making sure that, and I reminded her, I said, the more we work on equity and racism in our county, and peeling back those layers, the uglier it's going to get, because we're going to really start understanding the impact that racism and inequity has had in our community. And we have to get through that ugliness, and we have to stick together, and we have to find solutions. So Kathy, I appreciate you and your whole team in making sure that those experiences are heard, those voices are heard when decisions are being made, that we can continue to start making changes. And, you know, it's going to be incremental, but there will be a tipping point someday, I truly believe, where we will be able to see that we have eliminated the impact of this systemic racism in our community and the impact it's having on people. And then briefly, I just wanted to touch base on the long-term care conversation that Commissioner McGuire built up. I was actually sharing with my colleagues before the meeting my mom's story, right? Again, experience, my mom's story. My mom's 89 years old. She's in the independent living unit, but Ecumen runs it. You know, it's staffed with one person, you know, to manage, you know, the comings and, you know, rentals, right? It's actually a co-op, but, you know, they've got 4 people over 100, you know, 25 people over 90, you know, dozens of people over 80, 70, 60, but they can, because it's total, they have no connection to assisted living would be off-site at another, you know, Ecumen facility. It's not on-site. So they're not being treated as long-term care facility. And they're even, in some ways, even more isolated, right? Because they had to shut down so severely. I mean, there's no nurses coming in. There's no staff coming in like a regular long-term. At least there's some type of interaction and contact with people. And so I appreciate the recognition that, you know, we've got some of these gaps that we don't realize are out there. And that is definitely a gap, because right now, and I know Ecumen is just, you know, they're working every day to try to get folks out there to, you know, do this mass vaccine for all these folks, but they're basically being told, you're on your own, get in the lottery, you know, hopefully your clinic or your healthcare provider will get a vaccine someday. And you know, they're really high risk people. So I appreciate, you know, the conversation around that experience in our county too. Thank you.
Thank you
Madam
very
Chair,
much. Was there any additional comment there?
Yes, Madam Chair and Commissioner McDonough, thank you for those points. To go backwards, and you know, our communications manager brought this up early on because of personal experience of knowing somebody who is independently living within a large system. And so we took this on right away and connected with that large system and worked on a plan to connect these groups of people with a vaccine. And we continue to do that. And I do believe the agency that you named, or the center that you named, is on our list as well, and we've been working with them as well. It's just going to take some time because it was a gap, and unfortunately this was not something that was on anyone's, it could have been on someone's radar, but it got missed, and so we are working to help close that gap. I also appreciate your words around equity and where we are and where we're going. You know, it's very meaningful to hear you speak in that way and support this, because this is a huge problem. You know, earlier in the year we talked about racism as a public health issue. This is a prime example of how this is being perpetuated, and we are working as hard as we can to make sure that we're communicating with our state partners about our people in our minority-owned pharmacies and our minority-owned clinics who don't have access to any vaccine yet, and can be a huge partner in getting out more vaccine into the community. They're, as you can, you know, similar to opening up the paramedics and EMTs and allowing to have more people within that group of people providing vaccine, this needs to be done in multiple areas. And so we continue to push that message. We continue to be that voice along with our local public health partners to ensure that we have more access for all of our communities. Thank you so much for sharing that. I appreciate it.
Commissioner Ortega?
Thank you, Madam Chair. First of all, I just want to say thank you to Kathy, Laura, and Lynn. I think you folks are doing a great job. I, too, have had several constituents email me regarding that they went to get their vaccination and saw no people of color while they were being vaccinated. And by the way, these folks were not people of color. They made it a point to tell me they were white. So that was interesting that it's kind of good that there's awareness going on in our community. But it's also just a snapshot, right? You go in for 20 minutes, you don't see anybody that looks like you, and you make assumptions. So we just got to move forward. But I too have a 92-year-old mother who lives independently, and my brother and I were saying, how come she hasn't gotten any notification about her vaccination? Now, my mother could have gotten something in the mail, thrown it away. She cannot handle business over the phone. Just because of language is one thing, but also the fact that she's 92 and it's difficult. My point to all of this, and then when we did take her to get her vaccination, we also didn't see people of color there. But my point really is that we should be tracking this moving forward, because as we get more vaccine, if we see we have large caps in certain populations, we might have less constraints to focus better in terms of getting to those communities. I have no sense of what the numbers are in terms of the different groups, and neither does, of course, as you stated, Kathy, I read your email. I understand the situation, but I think we need to focus in trying to see how much data we could collect, because somebody like my mother falls through the cracks just because of all the issues, age, language, and so forth. And then we have lots of groups. We have Somalis and Hmongs in the same kind of situation. But otherwise, it's just something we got to keep an eye on. Thank you very much for your work.
Thank you. Commissioner Reinhardt?
Thank you. Well, I would just like to reinforce what Commissioners McDonough and Ortega have said. I serve on the Resilient Counties Advisory Board for the National Association of Counties. And generally speaking, in years past, we talked about natural disasters, flooding and hurricanes and all kinds of different things that were natural disasters. And one of the things that we made very clear, and it's very true in this case as well, is that disasters don't discriminate, but responses do. And it's because of the systemic system, or the systemic processes and things that are in place. And so it is important to shine a light on things. In fact, I was on a call this morning with the White Bear Area Chamber of Commerce talking about county issues, economic issues, and of course COVID, and said, we have to do better because it is, the disparities are pretty clear, and we don't, as a county, we don't shy away from shining a light on something. We said sometimes the picture isn't very pretty, but you're not going to do anything about it unless you do that. And so I am proud of our county board for the work and the speaking to truth. And that's what this is about. Disasters don't discriminate, but responses do. And we are doing our best to do better. Thank you.
Thank you for the comment, Commissioner Reinhardt. I would just say as we leave this topic that with all of the gaps that we see, I know our staff has been diligent in working to get as much communication to our community and also to our state regarding how we work together to ensure that we plug those gaps. I'm thankful for the website that has such good content at this point in time, and know that we'll continue to enhance that content so that people are aware of vaccination opportunities, even if they aren't our own. Certainly the constituent that contacted Commissioner McDonough was talking about the fact that her husband, her pastor, were able to get vaccinated. And I believe that this was at the VA. And it's interesting that some 65-year-old or older individuals may not be plugging into that as a resource. So if we are able to, with our site, give information about where vaccinations are happening and who is eligible beyond, of course, our own, such as we do with the state and the special clinics that the state has opened up for 65 and older. You know, veterans would be an example of that, and even helping to steer people toward the possibilities that their clinics may have vaccinations. Some of the more obvious pieces of information, if we could capture that on our site, and of course also as we communicate through trusted messengers, as we receive more of the vaccine, carrying those messages forward as well about where beyond, you know, those vaccination sites that we have, people can seek vaccinations. I would appreciate, and I know that will be something that you'll continue to build out in our communication strategies. I want to say thank you so much for being here to address our questions, but even more so for all of the work that you continue to do to address this pandemic, to assure that we are recovering and responding as we need to, and to look forward to doing so in such a way that builds forward even better in the public health realm and beyond. So thank you very much. I will turn back to the county manager and others to see if there are additional pieces of information before we move on to our moment of mindfulness.
Thank you, Madam Chair. I'll go back to Deputy County Manager Kathy Hadeen to close us out.
Thank you, Madam Chair, for those final comments, and I appreciate that you brought up trusted messengers. That was my last comment, that our racial equity and community engagement response team continues to be leaders with our public health community liaisons, and they will be continuing to host community conversations led by community so that we can make sure to help people understand that the COVID-19 vaccines are safe, and so that when the phases open up for more people to get them, that people of color do feel comfortable getting those vaccines. So I appreciate it. Thank you for lifting up our website, www.ramseycounty.us/coronavirus, where you can find out more information about COVID-19 and vaccines. I appreciate it.
Thank you very, very much. I know that there is a conversation coming up on the 4th on vaccinations. Is that true?
Yes, Madam Chair, thank you. Dr. Ogawa is usually the star of those lovely conversations. She does such a wonderful job of helping to, I don't want to say simplify, but she's really good at helping all of us understand what's going on around vaccines and COVID.
Thank you again. We appreciate the update, and we'll just take a moment for a moment of silence for a mindfulness moment, such as we have done in addressing the pandemic, the economic distress, the social unrest that has been in our midst. Just a very brief moment as we continue on in preparation for all our work. Thank you. We continue to want to recognize the great losses that we have experienced, the work we're doing together, and our hopes and, of course, efforts for recovery. Thank you. We're at our administrative items. I'll call on Commissioner Matas Castillo.
Thank you, Madam Chair. I have to move item number 4, the 2021 inclusion of support for Regions Hospital legislation for additional bed licenses and the 2021 legislative platform.
And I'd like to pull that.
Pull that. Item number 5, the 2021 master contracts for printing services. Item number 6, the 2020 joint powers agreement with the City of Maplewood and personnel complement increase in social services department.
I'd like to pull that.
Co-responder pilot project is pulled.
So would I.
Okay. Item 7, Amendment 5 to Professional Services Agreement with Elor Inc., Summit Food Service for food services at the Adult Detention Center and the Detoxification Center.
I'd like to
Item-
pull that.
Okay. Item 8, contract with Sheehy Construction Company for the Metro Square Building Curtain Wall Improvement Project. And item 9, November 2020, report of contracts, grant revenue agreements, emergency purchases, sole source, single source purchases, and final payment.
Second.
Second.
Thank you for the motion and the second. Let me see. Item number 5 and number 8 and number 9 are moving forward. Items number 6 and 7, items number 4, 6, and 7 have been pulled. And so we have a motion and a second on those items moving forward. Are there any comments? Roll call, please.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Carter,
Aye. Thank you very much. Those items have passed, and we'll call on, or we'll look for a motion now for item number 4.
I'll make that motion, or yeah, I'll second it. If Commissioner McDonough
Move
wants to make it,
approval.
yeah.
Yep.
And I'll second that. Thank
The
you.
motion and the second. And so Commissioner McDonough, I'll call on you.
Thanks, Madam Chair. This came to us late for the actual legislative platform processes. As you know, there's always emerging issues. M. Fairview announced the closing of St. Joe's, but there was a lot of effort by community and to hopefully get them to maybe extend that closing. They did actually close on the end of December 31st. They closed the ED and all their med-surg beds. They still are continuing to have mental health beds open. But Regents Hospital, if you recall, in 2018, there is a moratorium on hospital licenses beds, goes back to a 1986 law. It was really intended to help control, manage healthcare costs, and to get the right care at the right place at the right time, which is really important. But it does, again, create situations that aren't necessarily achieving those goals. Most hospitals and systems have literally hundreds of banked licensed beds that they can bring online to meet the needs of demand for patients. Regents is one of very few hospitals that has no bank beds. So in 2018, they went to the legislature for 100 beds because they continued to grow and meet the needs of the community and a larger community. Through lots of heavy negotiating, they were successful and got 55 of those. Knowing that at some point in time, hopefully these 55 would have got them through, 5, 6, 7, 8, maybe 9 years. But with St. Joe's closing, they really feel they know they're going to have to get those other 45 beds. So they're going back to the legislature this year. We're looking for our support because we're a key partner with them in moving this forward, working with our Ramsey County delegation and sending a strong support that we are supportive of this effort here. So that's why it's before us. I appreciate Commissioner McGuire as Ledge Chair, again, being responsive to emerging issues here as the session develops. Thank you, Madam Chair.
Thank you. Thank you, Commissioner, for bringing it to our attention. I will call on Commissioner McGuire next.
Yeah, and thank you, Madam Chair. And I just want to thank Commissioner McDonough for all of his work in this area. I pulled it so that we could recognize that this is a really important issue. Commissioner McDonough has just done so much work on it. I know we are, I'm glad it's before us to support it. We are going to hopefully get it passed at the legislature this year. I know Regents is working really hard on it, and we're supporting them in that. So I'm grateful that we've got it here today, and we hope that we get it through this time. So thank you, and thank you, Commissioner McDonough.
Thanks for all of the work in this regard, Commissioner Fretham.
Thank you. I just wanted to note that the RBA says that Ramsey County has not done any community outreach on this proposal. And while it may be true that we haven't done any formal outreach or staff hasn't done that, I know I received a lot of feedback from the community at the announcement of the closure of St. Joseph's and Bethesda about concerns about capacity in the East Metro. So although there wasn't formal outreach, we heard from the community a resounding message that we are concerned about where folks in the East Metro can go when there's an emergency. So I just wanted to call out that community piece, that this isn't coming out of nowhere or something we're deciding without hearing from members of the community.
Thank you for that point. All the more reason it is important that we move forward in this regard. Thank you to commissioners for your comments. County Manager O'Connor, did I hear the chambers?
No, Madam Chair, just a head nod in agreement of the comment from Commissioner Fretham.
Excellent. Thank you for your discussion and highlighting this item. We are on number 4. We have a motion and a second. Are there any additional comments? Roll call, please.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
Carter,
Aye. And thank you very much. I would very much appreciate a motion on item number 6, joint powers agreement with the City of Maplewood and personnel complement increase in the Social Services Department to implement co-responder pilot project. Is there a motion?
Madam Chair, I would like to move that.
Thank you.
And I'd like to second, Madam Chair.
Thank you very much, Commissioners Reinhardt and Matis Castillo. I did pull it initially, but I will call on commissioners for their questions first. Commissioner Reinhardt.
Thank you. And I was intending to do that as well. I think that and I know that Mayor Abrams, because I was in a meeting with her last evening, I know that she is on this call today as well and highlighted this. This is so important, and we have talked in the past about the number of people within our correctional facilities that have diagnosed mental illness and behavioral health issues. And I think the number that I remember was up to 80%. And so to have this pilot project going forward, I think is so critical to the community health, community public safety, and especially for our police officers who are out there keeping people safe. But if there's a mental health crisis happening, they need the services that we can provide, and that's what this does. It places a social service provider from Ramsey County as a co-responder to police calls. And I just am so pleased that we are able to move forward with this. And I know that the City of Maplewood has been an incredible partner in saying, yes, we need to do this. And I think it is going to be something that is going to be replicated many times over. And hopefully we can try to deal with some of those systemic changes that we talked about earlier when it comes to our public safety or our justice system. Thank you very much.
And thank you very much, Commissioner, for highlighting this as a solution that does bear promise to divert many from our law enforcement system, our corrections arena, and into areas where they can best hope to get the help that is needed. Our seconder on this, did you have a comment or question?
Yes, thank you, Madam Chair, and thank you, Commissioner Reinhardt, for leading this. I also wanted to thank our staff. When the mayor of Maplewood, Mary Lee Abrams, came to Commissioner Reinhardt and myself and asked for this, we immediately pulled a meeting together, and Ann Berry was quick to say, yes, let's figure it out. And so I really just want to say a great gratitude to our staff as well. We are seeing this co-responder model or police departments across the county that have embedded mental health units, and it's highly successful. And so the opportunity for us to partner with the City of Maplewood as well is really important. And that happens because we have staff that see the need and are flexible and creative on how we can make this happen. And so I just wanted to also say thank you to the staff who have worked really hard to make this happen.
Thank you again. My compliments as well to those who are working in this regard. We know that this is an incredible opportunity, and we're thankful to Maplewood for seeking out the opportunity, recognizing how it can, in fact, assist their communities and all of us in Ramsey County. I do know that we are in pilot with the City of St. Paul in this regard as well. So this broadens, Ed, and hopefully other communities will become a part of this work. I do see that our director, Ann Berry, is on the line with us, and I want to open this up because when we look at the word pilot, we know that in Ramsey County, we're not thinking about just doing things for a moment. You know, we are looking toward the change that isn't just doing things better, but it's doing better things to help enhance the services that we provide and in partnership with our partners for all of our communities. I do want to call on Director Berry to just talk about our thoughts about this work moving forward. There's a valuation component embedded, and our thoughts about our hopes for the future are what I'm looking for at this point as we consider this pilot and the work that we want to do beyond. Just a few comments in that regard. I'll call on Director Berry. Are you there?
I'm here, Madam Chair.
There you go.
And thank you for the question. I also want to say thank you to Sophia Thompson. She is on the line as well. Sophia is the one who did all the work, met with community, met with law enforcement, with the mayor's office, made this happen. So thank you, Sophia. Going forward, what our hopes are for the future is that more communities want to participate with us. So the city of Roseville, many cities, and I've set up a meeting with the Sheriff's Department because we want to be able to co-respond there as well. So going forward to build this out, and it really is more than a pilot. We are using the money we get from the Department of Human Services under the Adult Mental Health Grant, which has been a relatively consistent amount of money that comes to the county. We've always underspent that money. We think this is a good way to spend all of the resources that we're getting from the department. They like it too, and they want to be part of our evaluation work about how this works. The model will look different in each community because it's built out by the community. So what we're doing in St. Paul looks a little different than what we'll do in Maplewood, and I think it might, but we want to get upstream and we want to support people. Certainly before there's incarceration or any detention of any kind, and we want to serve people. So the Maplewood model is it's co-responding, but it's also continually working with people who have interactions with the criminal justice system. So we're getting much, much further upstream. So again, that's what our hopes are for the future, building it out for the entire county, learning from each of the models and making the model really specific to the needs that the community has. I hope I addressed all the questions you had, Madam Chair.
You did. I do appreciate hearing more about our hopes for the future and how we're driving toward a future that does incorporate additional responding such as this, and hopefully will lead to the avoidance of those law enforcement encounters with more appropriate solutions and alternatives. Thank you so much. And also thank you to Sophia, who is on the line with us as well, for all of the work that you've done to make this a reality with the city of Maplewood and also with other communities. Thank you so much, Sophia. With St. Paul, I should say, specifically. We'll look forward to the other communities and working with our sheriff. I do see Commissioner McGuire. I'm not sure. Have I called on? No. Commissioner McGuire.
Thank you, Madam Chair. And as I see Sophia on the line, I just want to give a shout out and thanks to both Ann Berry and Sophia for making this program work. I was just on a call with Sophia last Thursday night, a Minnesota statewide League of Women Voters call on mental health issues with former Representative Mindy Greiling, with the head of NAMI, Sue Eberholden, and we were having a conversation on mental health, and Sophia was able to talk about some of the work that we're hoping to do. She couldn't talk in specifics because we hadn't passed this yet. But we talked about how we wanted to do this kind of work. And I'm just so grateful that we are doing this kind of work because it is something that everybody, they specifically asked us what we were doing about this. And the people around the state are are wanting this money to be spent in this way. And we definitely in this community, I know the city of Roseville, all of my cities would love to have this program in their city. So I'm just grateful. And Sophia did a great job on the panel. She was wonderful, of course. And it's just exciting to have this work being done. And I'm just looking forward to it continuing. So thank you so much.
So we are all looking forward to it and have the opportunity now to vote to move this particular item forward. So we will ask for roll call. Oh, and let me just double check to make sure there are no more questions. I don't see any on the screen. And so I'll ask for roll call, please.
Modis Castillo,
Aye.
McDonough,
Aye.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Fretham,
Aye.
thank you. Carter,
Aye, thank you. And this has passed. Great thanks to all who are working in this regard. And thank you to the City of Maplewood for helping us to advance this work. We're moving on to item number 7, Amendment 5 to Professional Services Agreement with Eiler Inc. This is regarding food service at the Adult Detention Center and the Detox Center. Is there a motion, please?
So moved.
And a second?
Second.
Thank you. I appreciate the motion and the second. I know there were multiple motioners. I'll take that as Commissioner Fretham and Commissioner Ortega, then on the second. I do want to pull this, and I don't know if there are others who may have questions, but I'm thankful to see that we are making adjustments and working to keep our food service whole and ensure also the vendor stability in this area of food service at the detention center and also the detox center. Also noting that as we continue our work in justice systems reform, as we are looking toward pretrial justice work and ensuring that those who are in our detention center need to be there, that we are appropriately using that resource, we can anticipate, as we have been during COVID-19, maintaining a reduction. And if we do this work well, even seeing further reduction in this area. The contracts that we use to provide this service need to have some flexibility as we move toward the future. And I just want to know what the thinking with respect to making sure we have a balance in the food service quantity area that projects the potential of further reduction. So I did ask about this leading up. I'm going to check back in then with County Manager Connor to see if there's a comment with respect to maintaining that balance in such a way as we can see the ability to adjust in future years.
Madam Chair, members, thank you. I'll invite Kyle Mestad up from the Sheriff's Office to share any thoughts that he may have on your question today.
Thank you so much. And thanks for being here with us, Kyle. Don't see you, but I know you're on your way.
He's here.
Madam Chair, thank you for the question.
There you go.
To echo a lot of what you said, this is really about providing that stability for the vendor. The population's been reduced over 50%. We had to renegotiate the contract to ensure the vendor was still able to provide quality services consistent with the statutory outlines set forth by the Department of Corrections. And if Human Services is still on the line, I'm sure they can offer some comments and insights as well.
I'm sorry, I may have missed your last sentence, Kyle. What was that?
I don't know if Human Services is still on the line, Ryan, but...
Oh, okay.
It's still on the line? Oh.
Yeah.
I think Human Service, but isn't it corrections related? I don't think I have corrections on here today.
No, it's detox.
Ann Barry, I'm sorry, it's detox. Ann, are you still with us on the line? I can't see you, so I don't know if you're still here or not. Madam Chair, I think we've lost Ann.
Okay. Let me just thank Kyle then for being here with us to share that we are looking to make certain we're able to continue this contract. It's important that we're able to see people clearly, and I appreciate the adjustment at this point in time. The question really looks forward more to the future, and I know that you all, as you are working with us in ensuring that we have a real sight toward the future with respect to ensuring the appropriate use of our detention facilities, the pretrial justice work that we're doing, and we can anticipate potential reductions in the future. Just want some assurance that you're looking toward that and considering flexibility and future contracts that will allow us to make adjustments as needed.
Madam Chair, we'll definitely incorporate those elements into the contract that we negotiate going forward for food service. At the same time, as the board is well aware, the sheriff and our office have been very engaged with bail reform with the county attorney's office and continuing those efforts as well.
I appreciate that. I know that that will be incorporated as you think through how future contracts will be structured, and we really appreciate the continuing feedback in that regard. Are there other questions here? Kyle, thank you again. Then if there are no further comments or questions, I'll ask for the roll call.
Maras Castillo. Maras Castillo.
Oh, we can't.
I know I see her mouth moving, but I don't hear her.
Can't hear you.
Said aye.
We can't hear you.
It was an aye. If you want to try, okay, there we go, there we go. Thank you, let's keep going.
Thank you. McDonough.
Aye.
McGuire.
Aye.
Ortega.
Aye.
Reinhardt.
Aye.
Fretham.
Aye.
Carter.
Aye, thank you very much. The motion has, or the item has passed. And we are able to move on then to a legislative update. I'll call on Commissioner McGuire for that purpose. Commissioner McGuire.
Thank you, Madam Chair. Appreciate all the work that our team is doing. I can't believe we're already in week 5. It just feels like so fast. But Jennifer O'Rourke and Melissa Finnegan and, of course, Commissioner Matas Castillo and I continue to meet. But the week is full of virtual hearings. Huge focus on both sides, House and Senate, to have agency commissioners come in and talk about the budget that was released. So the governor did release his COVID-19 recovery budget, is what they're referring to it as. And we got details on that, so you can look in your emails for that. Highlights we care about, from cuts to our Community Corrections Act funding and other parts of the budget. Thank heavens our county program aid was left alone. We're disappointed in CCA funding, but there's a number of things to be worked on in the budget, so we can continue to talk about that. 2 hearings are happening today. At the same time, the House Public Safety Committee will be taking up House File 445, which is the SAFE account. This is going to create a new statewide account to deal with certain social unrest. And we did send a letter of support signed by Chair Carter and Mayor Melvin Carter. It's carried by Representative Mariani and Representative Bernardi to work on that. Also at 1 o'clock, the House Transportation Committee is taking up an overview of the I-94 Rondo neighborhood, the potential lid project there. So no bills, but there's a hearing on that, and Ramsey County will of course, be affected by that, so we're paying attention to that. It's not a bill yet, but just a informational hearing. And then we're watching COVID talk that's coming out of our nation's capital. The president is interested in a bipartisan agreement. We saw yesterday that he met with Republican senators, and they're bringing their own package forward. But the president has a $1.9 trillion package, which is, of course, daunting, but we're looking for ways to pass, they're looking for ways to get that accomplished so that we can actually get the resources we all need to continue to battle COVID. So one of the pieces that we are concerned about is the CARES funding that was a part of some of this, and we're watching that. Not sure that that's going to how much that's going to be, and then of course we want that to be significant. So that's what's going on there. I just want to thank everyone who testified last week. We had a really busy week of Ramsey County people testifying. Judge Freed testified. I know Commissioner McDonough testified in the House Behavioral Health Committee. Commissioner Reinhardt testified. I'm going to let other people talk about it. And then Commissioner Maniscalco, did you testify on homelessness? Okay, we have, but perhaps Commissioner Carter. But if any of you would like to comment on what you testified on, I'll let you make those comments. But it's just a reminder of how important Ramsey County is to, I know, AMC and to our legislature, that they can call on us to really bring out what's happening at counties for the work that they're doing. So thank you all for all of your work and being available to be in front of those committees. So thank you, Madam Chair.
Thank you, Commissioner McGuire, for the summary. I have Commissioner Reinhardt's hand up. Commissioner Reinhardt.
Thank you. Well, I was able to participate in a town hall meeting that was held by Representative Peter Fisher and then attended by Senator Uyghur, Representative Lilly, and they also had Washington County Commissioner Stan Karwowski on the call. And one of the issues that was brought up was on mental health, and so appreciated Commissioner McDonough's testimony. And as we move forward on this, how important it is. I do want to highlight the fact that Representative Fisher talked about the fact that we really need to pay a lot of attention to our young people, to the kids, because of the disruption in school, and you're in, you're out, the distance learning and not, and how difficult that has been for kids. And yes, I mean, mental health and behavioral health affects everyone, but sometimes we don't think about it as much when we're talking about kids, and especially teenagers. So I just wanted to mention that because I know how critically important it is, and Representative Fisher is chair of a committee on mental health and behavioral health, and moving forward and how it ties into all the other issues. I did have the opportunity to speak to the House climate clean energy legislation, and because I expected that I would have 2 minutes because I had been part of a meeting the week earlier, didn't have a chance to talk. I almost left the meeting right after my testimony and thought, well, maybe I'll just listen for a minute or two. And a lot of the questions that came back were for me, and so it gave me the opportunity to really speak to county issues and what we're looking at. And I just really appreciate the work that Melissa Finnegan and General Rourke are doing. We're well represented there, and appreciate them getting us to where we need to be when we need to be there. So thank you.
Thank you very much, Commissioner. Commissioner McDonough.
Thanks, Chair Carter. Yeah, it was a great, first off, I want to recognize that this Behavioral Health Committee is a new committee this year. We're really fortunate Peter Fisher, Representative Fisher, part of our Ramsey County delegation, is chairing it, but I think it shows the importance with Speaker Hortman that she's actually established this committee to be able to take on a lot of the issues are this meeting, and most of our meetings, it comes up somewhere. It is a thread everywhere, actually. So, I got my approach when I had the opportunity to testify was really kind of the big picture, the work that Ramsey County is doing. Talked about parity. I go back to Senator Wellstone and Jim Ramstad, who got the federal parity law passed probably 18 years ago, and we really have not made much progress on parity, whether it's on funding side, policy side, even on how we approach it. Talked a lot about stigma and the barriers for individuals in our community to actually seek help. And then I did want to report back to the board too that we were also afforded an opportunity for me and Melissa and Ann Berry and Sophia Thompson, who led the effort in Maplewood and was on the call earlier, to meet with Representative Fisher and just talk through some of the issues that are really important to Ramsey County, but really offer to Representative Fisher the opportunity to lean on Ramsey County for us to be able to bring our expertise in helping develop the policy, for us to be able to help move his priorities forward here so that we can see some real impact on this committee, and this committee will continue into the future. Thank you.
Thank you very much, Commissioner. Commissioner Matas-Castillo.
Yes, Madam Chair. More question on the behavioral health issue. Maybe Commissioner McDonough can answer. But how are our community advisory councils that we have at Ramsey County in our partnership? Because mental health is incredibly important, but we also have a huge community that has developmental issues as well that lead into the behavioral health, as well as our autism community, and how are those things being addressed as we're moving through this committee? Do you know?
Yeah, that's a really good question. It's not perfect for sure. And I know there's gaps, and I appreciate you raising that to help us continue to make sure we're filling those gaps. You know, the committees, the advisory committees that are specific to Ramsey County certainly help influence the positions we take both in policy as a board, influence staff and how we implement. And, you know, with Ann Berry and Sophia, a part of those conversations, that they're carrying that voice forward. We're hearing that. You know, some of the other community voices, we're actually testifying on the committee. NAMI, of course, is always testifying, but there were a number of other community organizations that were testifying and sharing their particular experiences. And as we identify, I heard you mention the autism, and that's probably one area where, you know, reflecting that we're not hearing that voice probably like we should be. And maybe we can be a little bit more deliberate here, but I'll use my opportunities in engaging with that committee to make sure that that voice is, there's a reach out for that voice and to hear those experiences and understand those gaps too.
Turning back to you then, Commissioner McGuire.
Thank you, Madam Chair. That completes my report. Just a huge debt of gratitude to all of our team that's continuing to work. And in addition to, as we've been talking, you know, our government relations team, it's really all of our staff that continues to be available for testimony in front of these committees, that they're working hard to make sure that the legislature gets the information they need. And just thanks to all of our staff that's doing all of that great work. So thank you, Madam Chair.
Thank you. And thank you to you and Commissioner Matas-Castillo for continuing to meet and ensure that our legislative work is moving forward in an organized fashion. To all of the commissioners, those who've spoken today about your visits, but I know all of our commissioners are active and engaged as we are close to the Capitol and able to represent in person, you know, as well as the phone calls and the letters that we are sending to be sure that we're getting the very best in all areas, you know, from clean energy to making sure that mental health is provided for in our communities. So thank you all so very, very much for the work that you're doing. And thank you, Commissioner McGuire, once again. We're going to move then to County Manager O'Connor for our County Connections report. County Manager.
Thank you, Madam Chair. 2 updates today, Commissioners. First, throughout last year, we did service delivery monthly updates. It started as weekly, it became bi-weekly, and then it moved to monthly as we moved through COVID and the rate of that change slowed. Those updates are all available on our COVID-19 page under service delivery, both the current status of our service delivery as well as the documentation over time. As we move into the new year, we want to continue to document and have a process in place by which we're evaluating potential changes, but we want to be more incisive as the rate of executive orders has slowed and impacts different areas of the organization at different rates. So we are finalizing an online process where departments through our intranet will be able to submit service delivery changes. It'll run up through their deputy county manager to the county manager. It'll then be documented in a way that will be posted on our website, and the changes will occur there as well. This is an early heads up. We'll send you a link to the final form so you can see the manifestation of this work. It'll be available in approximately a week, so we'll keep you posted. End of next week is our deadline to have it out, but that's the way we'll continue to make changes as we go through this year and whatever the future holds. Secondly, February is Black History Month, and so today's From the County Manager column will focus on Black History Month, particularly the virtual series that kicks off this Friday. There are 4 events coming up on Fridays throughout the month, the 5th, 12th, 19th, and 26th. Each of the activities runs from noon to 1. They have frequently been hosted in the basement of the county courthouse, sometimes over at Ramsey County East, but this year they will all be virtual instead. The topics starting this week are entrepreneurship, followed by diaspora, the talk, and family traditions. There's a lot of great information here about each topic. There are some wonderful speakers, as always, set to share observations and thoughts and reflections on Black history, which is also made every day. And it's an important moment for us as an organization and community to be reminded again that in a diverse community such as ours, and in a diverse country such as ours, Black history is our history, as much as other types of history are our history, and we look forward to celebrating with all employees, and particularly our Black employees, during the month of February. Thank you.
Thank you very much. I'm pausing to see if there is any question on any of the information presented by the county manager. We appreciate the report, and we're going to move on then to our commissioner reports. I will begin that with Commissioner Matas-Castillo, go alphabetically and back up to get Commissioner Fretham's report. Calling on Commissioner Matas-Castillo.
Thank you, Madam Chair. A couple updates. I attended the Immigrant Refugee Town Hall that was hosted last week, and I just want to commend our staff for a really fantastic town hall. We had great and wide participation of other service providers from the immigrant and refugee community, as well as community members who might be impacted. But I do want to also call out that during that town hall, we had some disruptors who came with bad intentions to disrupt the conversation and our support for our immigrant and refugee community in a really awful and disgusting way. And I want to say that even though it happened, our staff was remarkably resilient and calm, and we pushed through for a really great conversation. But also want to just mention that, it is one more example of how we at Ramsey County won't stand for white supremacy, and we won't be rattled by disruptors who don't share our values. And so it was really a prime opportunity for us to stand in that way and continue that work. And so as we celebrate Black History Month, as our history, as we continue to serve our immigrant and refugee community, that we stand strong and we will continue to support. And disruptors, beware, we won't be shaken. I also wanted to share that I serve on the NACO Veterans and Military Policy Committee as the vice chair. And good news is that Secretary McDonough, not related to Commissioner McDonough, has been appointed the new Secretary of the VA. And as you know, he's a local Minnesota friend as well. And so that's really great news as we continue policy and work on the federal level. We do have a couple bills coming up on the federal level that do impact our Ramsey County veterans, one being the toxic exposure bill, and we had many members of the Air National Guard from Ramsey County that served in that particular bill. And so that will be coming up with a hearing, which is great news as we continue to move forward on legislative items there too. We also had an update with the Rice-Larpenter Alliance that I know Commissioner McGuire and Commissioner Reinhardt have been active in as well. We had a presentation from Pack Properties, which is looking to develop a large affordable housing unit that is really blending the community, very similar to the vision plan that was written years ago by the community to preserve garden space and build for larger units for larger families. And so just knowing that we have a great developer who's looking to do and share those values in the area is pretty exciting. It is obviously some time out, so it's just in initial phases of development, but really good news that we have partners that are willing to build affordable housing in the area as well. So they'll be working with the city of Maplewood as well, since it's technically on the Maplewood side in the area. So lots of good, exciting work to come there. And then we had, and I'm sure Commissioner Reinhardt will share more, but we had a great community engagement session about the future of the South Maplewood properties, and had some new engagement and additional engagement from the community, which I'm really feeling good about the direction that we're going, and kind of the opportunity. There is a different form of engagement so people could begin to vision what else could potentially be there besides what currently exists. And so I think we're going in the right direction as we continue to move forward. And then lastly, we had an awesome meeting. Commissioner Fretham and I and Ling Becker were able to participate yesterday in the St. Paul 3K leadership group. As you know, this work has been in the background for several years about what does affordable childcare and education look like for all 3 and 4-year-olds in the city of St. Paul. And Councilmember Naker has been leading this effort diligently for the last few years. And it was, I will say, it was quite an impressive group of leaders on the call. There were leaders from the city of St. Paul, from the county, from the school district. It was chaired by Superintendent Joe Gothard. The mayor was participating in support of, but there was a whole host of business leaders and philanthropic leaders that I haven't previously seen in this space that are really dedicated to how do we provide potentially in the future high quality childcare for every family and education for every family with 3 and 4-year-olds. And that would be for free, every family that earns $75,000 a year or less. And what this would do would really even out the playing field for our families, especially our lower income families. And as we've experienced with COVID, you know, we call our workers, right, that we're caring for, our essential workers, that often fall in the same category that are also struggling with childcare. So we know there's overlap. And so I like to think of this as our essential families that we really would be able to level the playing field. So there's a lot of work to come, lots of work happening, but just know that this is something that leaders across the county and across the city of St. Paul are really passionate about.
Thank you so very much for that report. Commissioner McDonough?
Thanks, Madam Chair. Just a quick heads up to my colleagues. I seem to be having connection problems this morning, so I've already had to sign in and sign out twice to stay connected. So if I disappear, I disappear, but I won't be gone forever. Couple of quick updates. One is we had our Workforce Investment Board Executive Committee. We had a moment to celebrate, and I want to share that with the board. Commissioner Carter, as you're well aware, the Workforce Investment Board has not been in compliance with its
We cannot hear Commissioner McDonough, and I'm very, very sorry that we can't hear him right now. I'm going to trust that you're going to sign out and come back. Oh, there you are.
Back?
Back.
All right. Well, we'll see how long it lasts. Let me know if I'm off. But anyways, I don't know where I got off, but the web has its full complement of members for the first time in well over a year. I want to just recognize the efforts of Ling Becker, the current chair, Chad Wallace, and former chair, Karen McCabe. It's been a struggle, not because we don't have people interested in serving on our web. It's been a struggle to ensure that we have a board that reflects our community, but we're consistent with WIOA regulations on qualifications and requirements for membership. So we're good there. We had the Gold Line Joint Powers Board meeting last week. Commissioner Ortega and I, we are literally, hopefully, maybe hours away from a notification from FTA to move into final engineering, which is a big moment. We continue to take action and moving forward on right-of-way acquisition to prepare for that. I had the good fortune to be appointed by AMC to the MnDOT's state advisory panel on their 5-year plan. It's really a 30-year plan. If you recall, back in 2012, they put a lot of work into what's called Go Minnesota, and then a part of that is every 5 years they come in, do a recheck on that plan to make recommendations for the next 5 years. Did that in 2017, and I was fortunate to be AMC's rep then, and now we're getting ready for 2022 in that. So we had our kickoff meeting on that. And then yesterday we had our East Metro Strong meeting, continue to advance all our East Metro lines with a lot of conversations around ensuring that we've got 2 lines in play here on our arterial BRT, the Como, Maryland, and as Commissioner Mattis Castillo is well aware, Rice Street, Robert. They're going to be selecting one here, and we want to make sure at least one of those is an East Metro line. And then they'll be selecting 3 into the future, and we want to make sure both of those lines are a part of the next 4 lines. So we continue to work on that. Thanks, Madam Chair.
Thanks for your report and, of course, for your diligence in ensuring we are able to get that East Metro line. I'm going to call on Commissioner McGuire.
Thank you, Madam Chair. Just thanks to all my colleagues for all their good work. Yes, we're all working at all of our different groups on the East Metro line. I'm on Transportation Advisory Board, and I know that we're pushing there, and we're all just pushing as hard as we can for that line to be on the East Metro, that ABRT, and we're hoping it's the Robert Rice Street one. But anyway, thanks to everyone for all their work, Rice Larpenter as well. I think it's just exciting. I love the 3K where Commissioner Carter and I hear about that a lot in our St. Paul Children's Collaborative meetings, and just, am grateful for that effort that's being done. And I know it's for the city of St. Paul, and of course, we're all interested in how we can maybe make that countywide, but there's a lot of work to do in that area. Madam Chair, I was fortunate, and there were, I think, some others on the 21st Century Parks Town Hall meeting last Tuesday night. It was great to hear the public talk about what they want to see in their parks. So just grateful to the parks, to Director Mark McCabe and the parks staff for putting that town hall meeting on, and our research, or our civic engagement team for putting that on. We had a Joint Detention Alternatives Initiative meeting. Thanks to Commissioner Carter for her leadership on that. And that's just such a great effort that we have going. Recycling and Energy Board met, which I know Commissioner Reinhardt can talk about too, but just to congratulate Commissioner Reinhardt, who is elected chair of that board. It rotates between Washington and Ramsey County, and we're lucky and grateful that Commissioner Reinhardt is the chair for our Ramsey County turn, and you do such a great job there, Commissioner Reinhardt, and it's a great board to sit on. And I've already mentioned our League of Women Voters meeting where Sophia Thompson did such a great job, and we were great to be talking about what we can do about mental health issues along with Mindy Greiling in her book, Fix What You Can, which is an amazing book. Just give a shout out to Commissioner Mattis Castillo and Commissioner Fretham and I, who sit on the library work group. And that's, there's so much going on, and we'll be giving you a final report, but just to know that work continues, and Commissioner Mattis Castillo is doing a great job chairing that committee as we work with our library board of trustees and the 3 of us from our library board, and it's moving forward in a good way, I think. So thank you, Madam Chair.
Thank you for the committed work. We appreciate it. Commissioner Ortega.
Oh, he's not on.
Oops, he's not there.
He's not.
Sorry, we dropped off.
He must have had to drop off.
Yeah, and so we'll see him back, I'm sure. Thank you. I'll move on then to Commissioner Reinhardt.
Thank you, Madam Chair. Yes, there was a lot of activity that was going on, a lot of really great community engagement that took place. It's one of the positives, I guess, that have come out of COVID is that we are able to get people involved that probably hadn't been in the past. The Parks Vision meeting was great. The South Maplewood parcels and what we're going to be doing there, the community engagement there was great. I want to give a special thank you to Chair Carter. Starting out with the vision, mission, goals, and how that all fits into not just these parcels, but to what we're trying to do throughout the county. And it was a great framework to build on. And then followed by Mayor Mary Lee Abrams and talking about Maplewood's perspective and where they are coming from. And so and Perkins and Will did a great job. I think it was one of the most productive meetings I've been in as far as just really understanding where people were coming from. And so I really appreciated it. But Commissioner Carter, I think I told you afterwards how much I appreciated your comments, but I wanted to be able to say that here publicly as well. Great job. I also mentioned that I was part of a White Bear Area Chamber of Commerce event this morning where I was the speaker, really focusing on the economic development and workforce development and telling folks to go to the Ramsey County website. Ramsey County means business.com. I mean, with the COVID-19 dashboard there, and just really trying to make sure that we get the message out about that. And so we talked about that. We talked about Rush Line. We talked about the governor's budget and taxes and all kinds of things this morning. And I just, the governor's budget's only been out for about a week or so here. And I think maybe I mentioned this at the last meeting. I know I talked about it in other places as well. But when we were talking about the tax increases that are included in that budget, I still think that it will just resonate with me for a long time, is that the governor said, if you make less than $20,000 per week, you won't be affected by that. And I think that that's worth noting. We've got a lot of needs that are out there and trying to meet the mandates that we have as a county as well. And so, and as was mentioned, the Recycling and Energy Center Board met, and I am honored to be chair of that. The Partnership on Waste to Energy also met, and that is the R&E Board and Hennepin County, and I am also chair of that this year. And so as everyone knows, I love the environmental work and specifically what we can do and how we are moving forward. And that's actually what I stressed in the testimony that I provided as well, is yes, this is what we're doing now, but what we're trying to do is going to move us so much further forward. And the new projects that we have, the requests for proposals and ideas on anaerobic digestion and gasification are the next steps. So we're not slowing down. We're really trying to make sure that we are moving forward in the best environmental way possible. And I'm very proud of our staff and working forward. And finally, I'd like to end with a comment that we had a lot of discussion in our visioning session workshop last week. And it was pointed out by Commissioner McDonough, and I actually stated this morning and at a meeting, at the town hall meeting and at other meetings as well, is that it is true that we are the implementers of state and federal policy, and we have a lot of mandates that are on us. But I said the equal and important part is what Commissioner McDonough commented on, and that is that we are also in a key position as influencers. And one of the ways that we are able to do that is through input, through community engagement, through all the different aspects of how people can contact us. And so being influencers and not just sitting back and saying, okay, well, what are you going to make us do now, is I think so incredibly important. And so I just wanted Commissioner McDonough to know that I'm now going with not just implementers, but implementers and influencers, because that is our job. Thank you.
Thank you for all of the work that you're doing to influence great policy for not only Ramsey County, but for our state. We do have Commissioner Ortega back. I'm going to circle back to get to Commissioner Ortega. We'll finish up with Commissioner Fretham, and then I'll make some brief comments. We have two workshops ahead of us today, and we'll get into those quickly. So, Commissioner Ortega, welcome back.
Thank you, Madam Chair. And I'll make this quick so we can get to our workshop. Excuse me. We had a meeting of the Food Committee, and we gave an updated report. Of the 10 million, we spent 9 million. 3 million was allocated to a school district, and they had only spent 1 million. But we quickly pushed out most of the money, and we have 1 million, which the finance department now, under the guidelines, we're going to redistribute. So all went well, and now we're just waiting to see what happens with the federal and state government in terms of how do we continue this program, and a discussion this board is going to have. The also had a meeting of the review of committee. Councilman Naker and Tolbert and Russ Stark from the mayor's office, we sat down. Last week, I met with the mayor of Bloomington and Deb, the commissioner from Hennepin County, and picking the community advisory group. In both cases, we picked close to 75% of the committee in each case, but we wanted to get more people of color and more people who were actual transit riders to be part of the committee. So we've extended the invitation. It's on our website for the next couple of weeks. So if you know of anybody that lives along the corridor, encourage them to apply. I had a meeting with former State Senator Saltzman regarding Real Hope Project. And this is run by young folks, 20-something, very impressive. They are certified by the state. They work with at least a dozen counties right now. And Real Hope is REEL. And what they do is they put together, they work with adoption services in the county. And they put together videos of the young people, positive videos of the young people that are in our system for adoption. And it makes it easier for those who are interested to sort of get a sense of who the child is and how they interact. And they worked very well with them. It was very impressive. I connected them with Ann Barry to meet with our adoption folks as another tool. As you well know, that we have a lot of kids in our adoption services that stay there, that don't get adopted. And so this is another effort to try and put these children in front of folks, especially during these COVID times. I'll leave it at that, Madam. The rest of it, I'm sure the meetings that we've all attended in terms of the Energy Board and so forth. Thank you, Madam Chair.
Thank you so much, Commissioner. Commissioner Fretham.
Carter, I don't have much to add. Most of the meetings that I attended in the last week were covered elsewhere. So just want to note that in addition to the transit work that Commissioner McDonough raised, there are some legislators here in the Northwest Ramsey County who are really interested in moving and extending the A line. And I'll be joining a meeting with them over our lunch break today to talk with Met Council representatives on that and what that would take. So we are working to move on multiple fronts to extend transit access here in Ramsey County.
Thank you so very much. I'll just mention that so much is going on. You all have covered a number of the meetings that we've been in together. I was able to attend this past week a graduation celebration, I should say, from some of our COVID-funded youth programming with East African communities and other youth from communities of color. in the IT area. It was great to see some of the product of that work that has been happening and to look forward to partnerships into the future. I also was able to visit Capitol Ridge, our homeless shelter for senior citizens located at the Best Western near the Capitol, and to see just some excellent service in a community that has been built and can now be called home by so many who would otherwise not have had a home during this pandemic. So thank you so much to the Director Settles and also to our Housing Stability Director, who is doing such great work for us, Mr. Latimer. I attended a public safety first community first public safety meeting of the city of St. Paul, and that work continues and will short-term deliver a set of recommendations to the mayor for the lower priority calls to be considered by mayor and city council. I'm glad that that work is progressing. Many things are going on. Our JDAI stakeholder meeting, which has also been mentioned by Commissioner McGuire already, has selected a number of work group areas. We were able to observe that our juvenile detention statistics for this past year were detaining less than 500 young people in our detention center. And we celebrate that. We know that there was certainly some impact of the pandemic, but we are continuing to find alternatives to our detention center. We'll continue to work in that regard, but even across the board in broader areas, such as reducing displacement of our youth and looking to the partnerships that will help us to continue developing out the set of alternatives that are so greatly needed. I will just mention that from our strategic planning session, I want to thank all of you for your participation in uplifting and confirming our mission, our vision, working toward the strategic engagements that we have around ensuring we're able to achieve our vision of a vibrant community that is valued and that thrives beyond pandemic, even during pandemic, as we continue to focus our work and certainly lifting forward to beyond. So thank you. I'm not going to share more because we do need to get off this call and on to our next workshop, which will be convened in a virtual webinar. The first workshop will convene shortly after this meeting, after our recess 10-minute break, and that will be on a holistic approach to ending youth displacement. It will be a webinar, such as I stated, and is posted on our website. And the second will convene at 1:30. It will be a virtual workshop on the City of St. Paul People's Prosperity Guaranteed Income Pilot Program. I'd like to thank Commissioner Fretham and Commissioner Reinhardt, respectively, for chairing those two workshops. With that, we are going to recess, and we will come back together at, let's make it 10:46. 10:46. And with that,
Madam,
I'm sorry. Yes, Commissioner?
You stated that we were going to recess, and in fact, we are going to adjourn the county board meeting and come back.
I am about to adjourn the county board meeting. Thank you for correcting my language. And with that, we are adjourned. Thank you.